Hey guys, I hope you are well. Today we're gonna talk about acute and chronic apical alveolar abscess. Generally in abscess, it's due to pulp necrosis, but pulp necrosis can cause of the trauma, chemical, mechanical irritation. For symptoms, we have tenderness, pain relief by slight pressure, severe throbbing pain, swelling, mobility, high temperature, fever, and headache. For histopathology, as you can see, we have widening of the PDL and as well we have pus. And also, because of the bacterial infection and neutrophil infiltration, we can have a tissue breakdown. For differential diagnosis, we have periodontal abscess. For periodontal abscess, we can diagnose it with location of the abscess, and it's usually associated with vital pulp and periodontal pocket as well. So EPT test is requirement. For treatment, RCT, drainage, antibiotic. And antibiotic for patients who have systemic reaction is requirement. Clinical test, EPT negative and pulp sensibility negative because our pulp is dead. Percussion is positive. Periapical radiolucency we don't have. We just have widening of the PDL because it's in earlier stage, and palpation is positive because we have swelling. In 35 years old male, severe pain, throbbing pain, and it started suddenly 2 days ago, a swelling of the gum and mild fever. For clinical examination, we have carious lesion here, pain on percussion and palpation, localized swelling and of the buccal vestibule, and negative response to colon electric pulp test. Also, in the picture, we don't find any well-defined radiolucency, and we have a little widening of the PDL. So the diagnosis is acute apical abscess. In chronic apical abscess, definition and etiology is the same with acute, but in most of the chronic disease we don't have symptoms, so it's asymptomatic, but sometimes maybe mildly painful. For histopathology, it's the same with acute, but in the chronic apical abscess we have um, sinus tract. So it's this main symptom of the chronic apical abscess, sinus tract. Differential diagnosis. In cyst, sclerotic outline, we have in radiolucency. In apical periodontitis, asymptomatic, we have circumscribed radiolucency. But in chronic apical, is diffused. So EPT test is requirement. Treatment, RCT and inserting gutta percha into the sinus tract to trace it radiographically and finding the source of the infection. Clinical test, EPT negative, percussion negative, or different feeling, pulp sensibility no response, periapical radiolucency present, and palpation is positive. 6 years old, painless swelling, large carious lesion, discolored and non-responsive to electric pulp test, palpation, soft elevation, and we have sinus tract. This is the main symptom of chronic apical abscess. So when you see sinus tract, for sure it's apical abscess, chronic apical abscess. And also, here is mentioned well-defined periradicular radiolucency. So this is chronic apical abscess.